Calcium chloride. Assemble a new blunt fill needle and 10 milliliter syringe. Remove the cap from the medication vial. Clean the rubber top with a new alcohol prep. Next, draw up the 10 milliliters of calcium chloride into the syringe. Inject the 10 milliliters of calcium chloride into the medication port of the bag of D5W. Safely dispose of the needle and syringe in a sharps container. Gently mix the medication and its diluent by tipping the bag back and forth. Next, spike the bag of medication with the Sapphire pump drip set. On the back of the cassette, we can depress the flow stop tab that will allow the medication to flow through the drip set. Once all air is expelled, we can release the tab and stop flow. Open the cassette chamber door. Next, we will install the cassette into the chamber. Place the forks on the bottom of the cassette into the pins and pivot the top side of the cassette into the pump. You will hear an audible click when the cassette is properly attached to the pump. Close the cassette door. It will latch shut. Tap the on-off button. The pump will run through a brief warm-up and self-test. Notice the clinical care area, adult or peds. To change the clinical care area, select Change on the bottom left and select the appropriate clinical care area. To accept the clinical care area as shown, tap Accept. Select New Infusion. Tap the To button 3 times to select the letter C like you would on an old cell phone. Tap Find. Select calcium chloride, 0.5 grams per 10 minutes. Select 1,000 milligrams per 100 milliliters. Select volume to be infused. Calcium chloride is an exception to our rule of entering the size bag we are infusing. If we were to input 100 milliliters, the pump would infuse all of the medication. Per protocol, we need to change to infuse half of a gram. To do this, we will type in 50. This will tell the pump to only infuse half of the volume, giving us our required half of a gram dosage. If our patient requires a second half of a gram, we can later infuse it and still be under Maryland Medical Protocol. Select OK. Select Rate. Per EMIHS, we always select a number in red on the right-hand side. For this example, type in 50. Select OK. Notice the time of our infusion is auto-calculated out to 10 minutes. Select OK. On this screen, we can verify all of the information entered is correct. Our medication we are administering, the rate of infusion, volume to be infused, the time in which it takes to infuse the medication, and the concentration of our medication. If all of this information is correct, tap Next. We now confirm that we have prepared 1,000 milligrams of medication in 100 milliliters of volume. Tap OK. Tap Start to start the infusion.